This is Dr. Dominik Nischwitz, more known as Dr. Dome, the biological dentist. He's one of the coolest guys out there, and I've been following him. I'm a big fan of his for quite some time now. He is the founder of DNA Health and Aesthetic Center for Biological Dentistry in Tubingen, Germany. He's a father of, is it 3?
Yeah, 3.
Father of 3, sports guy. He loves his sneakers. He's got an amazing sneaker collection. He also created an amazing health concept. He's into supplementations, food, nutrition. So we've got 10 questions for you, Dr. Dome. So I'm going to get straight into it. And so here we go. As biological dentists, we both share the philosophy that dentistry is more than just fixing teeth, right? Removing, replacing, restoring. It plays a very important role in patients' general health. And that we are capable also to, through good dentistry, improve patients' immune system. Can you explain to our followers in this interview how dentistry, nutrition, and body chemistry, like our general health, all fit together and complement each other in the field of biological dentistry?
Perfect question already. So in my opinion, consequent biological dentistry is exactly this. It's the overlap of functional medicine, biohacking for the cool kids, health optimization, and high-tech dentistry, the aesthetic dentistry, the ceramic implants part, with one goal, and this is being optimal health for body, mind, and spirit by actually starting in your mouth. Because basically, the mouth is where all your whole body starts. Yeah, it's kind of like you have a worm here. It starts from your mouth. It's everything that you eat, and it will go outside to the back door. So everything in terms of the whole body system will start in your mouth. And we have to take care of this because basically as dentists in university, we are trained more for the high-tech and technical skills. And we don't necessarily see the overall picture. It's more like a reparation and maintenance job. So for example, drilling holes when you're having a cavity, or doing a root canal treatment to restore the bite if you have massive pain, or some orthodontics, or maybe aesthetics. But the connection to the mouth as a mirror of your overall health is seldomly done, I would say. And this is basically my search for my own optimal health for the last 20 years, which led up to this whole concept. And if you do that consequent, you can really help people getting healthy. And I think this is what a doctor should stand for. So we can combine everything. We can combine improving your optimal health, your immune system, your nervous system, your detoxification, your gut health, your brain health, basically everything by starting in your mouth. And what we do is, of course, we look at this whole mouth a little bit differently than the regular conventional dentist. Would you agree?
I couldn't agree more. And just for some context here, we met at a congress. I was lecturing in the south of France, and you came to sit next to me at all of this energy. And, I've been lecturing for 18 years, high level on implant dentistry, cosmetic dentistry, digital dentistry. These are my passions, And you sit next to me and you're, with all of that energy you have, and you start talking about what you're talking about now. And this is what, 4 years ago? 4?
Yeah, around about 3 to 4 years ago.
3 to 4 years ago. And I'm like, yeah. Like, whatever, I'm Miguel Stanley, I know that. And because this is nobody's talking about this. It's a hidden. And it's really unfortunate because, as dentists, every dentist in the world knows that they don't get the respect that they should have from the general medical community, right? I was in a big meeting in America, and like one of the biggest trends right now in the dental universe in the US is connecting oral health to overall health. But when you hear the ways that they're doing that, they're doing it from a mechanical perspective, an emotional perspective, a functional perspective. I don't really see them go as deep as you're discussing now. And I think that we're not taught that at schools. I think the curriculum at universities needs to change. And the way I see it, that, you know, the efforts that you're doing, and a lot of people like you, where I'd have to say you're at the top, bro. I mean, a lot of mad respect to you.
Thanks, man.
But you know, where your fight is heading, and you won me, you've won our team. We're doing it. We're believing in it. And we've seen the changes. And, you know, I've even done it on myself. I had my cavity. We'll get into that later.
Yes.
But it really is impressive. So I think that what you're talking about is the absolute bridge between dentistry and mainstream medicine. And so we're going to go through a few more questions here. But we now know that the trending topic is COVID-19. So what advices would you give people on how to maintain a good oral health as a barrier to COVID-19, and build that into improving your immune system, and how people with a good oral health would be better prepared to fight this battle?
Yeah, basically we know from COVID-19 that this virus lurks in your oral cavity and in your sinuses for at least 6 to 8 days before it will reach anyways your respiratory tract. And of course, oral care, if you just go locally with just a general recommendation, would be that you use something like oil pulling on a daily basis, for example, which will just help with being antiviral, being anti-inflammatory. You should use extra virgin coconut oil. There's monolauric acid in it. It's proven over years that it's good for your immune system. It will help your oral microbiome to actually, defend these things. What you also could do, and this is a common consensus for COVID-19, is you could use HOCl, which is hypochlorous acid spray, just to disinfect. You know, every dentist knows hypochlorous acid for this disinfecting root canals.
And it's not that aggressive to the tissue.
Exactly. You can spray it in your mouth, you can spray it in your nose, you can spray it on everything basically, because it's not too disinfecting and it won't harm your oral regular microbiome, which is critical. We probably will go into this later, too much. And another thing would be just locally, maybe propolis or stuff like this, just from the oral perspective. But of course, it goes way deeper, because your whole immune system is basically changing with your daily lifestyle. And this is where my food design concept will come in. So all of our patients, anyways, before we see them, will be going through a lifestyle change in order to boost the immune system, regenerate, and we will do macronutrient. I call it macronutrient.
That's what I wanted to talk about. So I know that you promote super supplementation, especially as support to dental treatment. So just so people can understand, a lot of Dr. Dome's work, much like my own, is changing failed dentistry. So patients travel all around the world to visit him, as much as myself. And what they do is they want to have failed dentistry replaced. But what Dr. Dominik has been talking about for such a while now is that treatment shouldn't just be mechanical and aesthetical. It should also improve and boost your immune system. So your supplementation process, what are the biggest nutrition tips? How are you doing it? What are your steps? Talk about that.
Yeah, easy. So every patient will send in at least a few critical blood work. So I'm a big fan of quantifying. And also, because you're talking about supplementation, I'm a big fan of food first. So just go with the critical nutritional parts first. So you have to have these micronutrients with macronutrients, which is protein, fats, and carbohydrates. Basically, everybody should know about these things, but don't. And of course, we designed the food evolving around enough protein, because protein in itself, amino acids, it's a smaller part of the protein, is what your immune system consists of. And normally we use this for, of course, our bone healing phase, because we're doing ceramic implant surgeries, cavitation surgeries. I want to have my patient anabolic as anabolic as possible. By anabolic, I don't mean steroids and bodybuilding. I mean just building tissue, able to build tissue instead of being catabolic. So protein is always first, protein, amino acids.
And give us an example. So that's a high, like a lot of meat, a lot of fish, a lot of, what are you talking about here?
Yeah, protein is, you could go with food. It actually doesn't matter if you do a plant-based protein or if you do animal-based protein. What matters though is actually the quality. So if you go, so there's two sides of the coin. There are these extremists, which are vegans, which is a big trend. And another trend in functional medicine or in the field of biohacking is carnivores. Those are guys or girls that only eat meats and animal products. So going from both perspectives, and I have tried everything, as you know. You could do both, but processed food is always shit for you and your immune system. Just kill it right away. So if you go, we just have to start with what you should not do right away. So there's a critical...
And you have a guide like that. So we know that you wrote a book, right? Your book, which was published by Amazon, recently translated into English, called It's All in Your Mouth, right? And I know it's selling super well. You talk about the principles of biological dentistry and the key to whole body wellness.
And
in your book,
part about nutrition, yeah.
And in your book, you talk about critical danger of cavitations, amalgam fillings, root canals. What brought my attention here was the way you explain the natural immunity to chronic disease and integrating dental hygiene into the whole body health. But you also do talk about nutrition. So just talk extensively about what steps these followers and people that are going to watch this interview could take at home.
Yeah.
And second, if they have dental issues and are going to the dentist, what they should do.
Okay, I'll wrap it up pretty fast. So there's a few critical things you could do right away. First of all, get rid of everything that would stress your immune system on a daily basis and lead to silent or chronic inflammation, pro-inflammatory state, which is no sugar, no dairy, besides butter, no grains, actually, and at least no gluten, but I'm a fan of no grains at all. And what probably is the biggest here is vegetable oils, highly refined vegetable oils like canola oil,
olive oil.
Olive oil is a good oil, yeah.
Okay. I'm in Portugal, man. I gotta have my olive oil, you know.
No. The highly refined omega-6 fatty oils like canola oil, like when you go to the supermarket and you see these plastic bottles with this yellow stuff in it, which you're supposed to use for cooking. You know what I mean? Yeah. This is mostly canola oil, refined canola oil. This is mostly sunflower, safflower, or even soybean oil. This is so inflammatory. Just leave that part away.
Don't forget what you're going to explain. But right now, there's a lot of people saying, what the hell is a dentist doing talking about nutrition?
It's funny because I'm also a naturopath and functional medicine doctor.
So explain to our audience what that means.
What a functional medicine doctor is? So a naturopathic doctor is basically someone who also uses everything that's available besides conventional medicine. Could be Chinese medicine, could be nutritional medicine, supplementation. Functional medicine actually is a term from medical school. It's a new term which is developing in the US. I did the course over 10 years ago. It's more like, let's say, quantifying yourself using more lab work, data, like stuff like, for example, all your blood work, your hormones, everything, and fine-tuning and optimizing these things by nutritional changes, lifestyle changes, micronutrients, macronutrients. So big thing, of course, at the beginning was for me how to osseointegrate my ceramic implants and just build bone. And overall...
So that's how it started. So basically, as a dentist, you wanted to have better results in your surgery. So you went on an adventure to figure out, how can I have better results? Because I've known you, you've come to White Clinic, we've hung out, we've had dinner, you with my wife, and my wife, she just joined us. She's a big fan of yours. We've got Eleni. I have a lot of friends that are big fans of yours, Dom, and also Anapaj on my team. Yes. And this is such a relevant topic. And I think that, it's such a big topic as well.
It is. Let's go from the dental point of view. So initially, I started something called the Bone Healing Protocol, which is based on micronutrients, actually, like vitamin D3, because I looked deep into the science on PubMed of how is vitamin D3 working in your body and what does it actually do for bone healing and osseointegration. Because I'm only doing ceramic implants, and ceramic implants only osseointegrate in your bone if your body is able to actually build bone and tissue. This is where the side of functional medicine and naturopathic doctors and nutrition comes in, whereas a titanium implant osseointegrates totally differently. It osseointegrates through an ongoing chronic inflammation with pro-inflammatory cytokines like TNF-alpha, IL-1, IL-6, IL-1 beta, NF-kappa B, and I don't want to have this. I'm having a lot of patients which are chronic disease or chronic sick, and on the other spectrum is high performance athletes, CEOs, people that are achievers and want to have like their optimal health. So I'm having an extreme spectrum of patients in the first place, chronic sick and athletes or performance stuff. So I had to look into this.
So, for example, I mean, you know, I've traveled to over 50 countries as a dentist talking on advanced dentistry and this topic. And, you know, again, everybody who's just joined us, you can go to Amazon and download Dr. Dome's book. It's called It's All in Your Mouth. It was originally published in German. It just got translated to English. And I'm sure that all of this information you can find there. Also, follow Dr. Dome, and the amount of information that he has is incredible. But if you actually slow down and take this time, you know, during your quarantine to understand the correlation, that healing. So as dentists, we're trained to, you know, you do macro, take out a tooth, scrape the bone, put in an implant, you know, or just if you're doing an extraction, take out a tooth and let the body heal naturally. So yes. I also talk a lot about this process. So let's just talk for people that are beginning. A normal extraction, if I have a tooth that I need to take out and I'm not having an implant, I have to take out a tooth. This is probably the cheapest, most common dental procedure in history of the world is an extraction, okay? So a normal extraction of a patient, they will come to any clinic, they give an anesthetic straight away, and they'll pull out the tooth. And then what do? They'll probably put a cotton wool and say, go home, take an anti-inflammatory, take maybe an antibiotic. And if it gets infected, take an antibiotic. And in 1 week, you'll be okay, right? This is pretty much what I was taught at school, all right? If it was a wisdom tooth, would probably pre-medicate with an antibiotic. Now, let's keep it really simple. Because you know, you're such a genius guy. I'm going to, during this interview, bring you down because I want the basic dentist, the basic follower to take messages home. And I have more questions for you. But I want to say a simple extraction. How do you start? How would you start a simple extraction? No implant, just extraction. So when does it start?
Yeah, it starts at least 2 to 4 weeks prior to surgery. Why? Because we want to quantify how is your vitamin D3 level. The question here is your body, your inner doctor, able to regenerate bone and tissue? Yeah,
and you do a blood test for that. So there's a blood test.
Yes.
And we all know Joseph Shuchrin's study from 2012 of the correlation between cholesterol, vitamin D. So there's a specific blood test a dentist can ask for his patient to do, and he reads this. Now, if he comes back and the vitamin D levels are low, what do you do?
Yeah, we will then supplement. We will then change his nutrition, his diet to support building blocks that will help with tissue, bone tissue.
Such as, I mean, I know this because we're a big fan of your supplements. Yeah. What are the specific, imagine somebody says, I don't want to change my eating habits. I've tried diets, I can't do it. What supplements do you give?
So the first go-to supplement is always vitamin D3. But you cannot, and we give 20,000 IUs of vitamin D3 a day, which is equivalent to around about 1.5 hours to 2 hours of sun a day. And it's very important, the research is pretty clear, just do your PubMed research. You need to have vitamin D3 from the sun every day, and this is not possible in Germany at least. And I think in Portugal it's also not possible year-round. Yeah. It's better in Portugal. Vitamin D3, but vitamin D3 is there to basically bring calcium ions back and also activate enzymes like maybe your dental colleagues have heard of this osteocalcine, MGP, that will then in combination with cofactors like vitamin K2, MK7, and magnesium bring the calcium and all the other minerals into the bone and into the tooth. It's basically the same science. But before this, you need enough protein and amino acids in your diet. So you will start 3 to 4 weeks before a simple extraction, which is the cheapest dental procedure possible, and then you will measure their blood levels again before the surgery. Yes. So they will send in their initial vitamin D3 level before I even see the patient. And when they come into our health optimization week, on the first day, on the initial examination, we have a machine where we can do a simple chair-side finger prick vitamin D3 test.
Yeah, we've been using that as well. It's amazing.
It's amazing. And we can see, okay, is he good on his supplementation? So what we want to see is optimal levels of vitamin D3. That means at least 60 nanogram per milliliter, even 70 if possible.
So now the vitamin D levels are good. You go into your extraction protocol like a normal dentist. You'll give your anesthetic. You'll set up a clean, sterile. I'm a bad fan of slow dentistry, so properly prepared, properly disinfected. And then you'll do your surgery. And then how do you treat? What would you do different as a biological dentist to a normal extraction in terms of technique?
So technique is for sure. What we try to do is go as minimal invasive as possible. We don't use, if possible, no cuts at all. And we will, for example, remove the tooth with piezo surgery, like very, very minimal invasive. And then if everything's clean, so I try to not even touch the gingiva or the bone, which is healthy. I only clean out everything that's not healthy. Like, from Brannemark, yellow bone, no implant. So all the yellow bone has to go because this is osteolytic bone. It's chronic ischemic bone disease, fatty degenerative osteonecrotic jawbone, whatever you want to call it. So we have to make sure everything is perfectly clean. Of course, we remove the periodontium. And what we also use is ozone. Why? Because every study also in dentistry is showing that ozone kills bacteria, it kills pretty much all microbes.
I've been using the ozone device now, which is quite affordable for people watching. You're looking at 2,500 to 3,000 euros for this little ozone generating device. It has these little glass tips with several sizes that goes into the bone.
Yes.
So my question is, I would say that since I started using the ultrasonic piezo tip to clean the bone, I think that that's a step that is, most dentists, when they take out a tooth, they just go with a manual curette. And sometimes the size of the curette doesn't get into the apex because the apex is the thinnest part and the cyst usually would be at the base of the apex. So I think that a lot of fast extractions miss the cyst, miss the cavitation by completely. So 100%. I would ask you as a surgeon, I'm a surgeon as well. I've started practicing, I call it the 1, 2, 3 method in an extraction, where 1 is extraction, the surgery, like you just described. 2 is the cleaning. And 3 is the suture. I will spend 1 is very fast. 2 and 3 is where you spend most of your time.
100% agreed.
Cleaning. So I'm spending so much more time at the apex of the tooth. Do you find that as well as something that is important to do?
100% agreed. So basically, you have to get rid of all tissue, cysts for sure, periodontal ligaments, and also you have to know about this concept of cavitations, which is a total wrong term. It's just a layman term for something called chronic ischemic bone disease, or the better wording is FDOJ in English, fatty degenerative osteonecrotic jawbone. And this is described, there's a lot of PubMed reviews actually on this. It's chronic silent inflammation in your jawbone, and a lot of times, and Miguel will support this, it's below the apex. So we always have a cone beam in place.
I actually want to just do a little pause here, because I would say that this topic of cavitations is big. It's big. It's big. We don't hear about it in universities. We don't talk about this. It's not discussed in lectures. I mean, apart from yours and a few other top speakers. And when you bought this, you came to our clinic and you showed us this video that you've been making, and you told us the story of the Austrian guy that donated his head to science. And I started thinking about this. And since I also work with the CBCT like yourself, you trained me to look at it. And once you see it, you can't unsee it. And it's crazy. It's like one of those images. You've been seeing CBCTs all your life. Once you start seeing it, you always see it. Now, the most common locations for a cavitation are old extraction sites, such as wisdom teeth, correct? Where else can we find them?
Yes, basically wherever you had a tooth taken out, yeah. Every dentist here in this conversation that is listening and is doing implant surgery, if you drill and you fall into the bone, like,
happens a lot.
Happens always. I asked my first doctors, I'm an oral surgeon, and who trained me, he was doing a lot of implants, 1,000 a year at least. And I asked him, why am I falling into the bone always? What is this, Dr. Wolf? He's like, never mind, it's just normal. But these are cavitations. And
100%.
maybe for 100%. And maybe for titanium implant surgery, it's not a big deal because titanium implants also integrate with the same inflammatory cytokines as the cavitations. Whereas if you are just from a dental point of view, if you want the ceramic implants to be also integrated at the end, we have to take care of perfectly healthy and clean bone. It's not about the implant, it's only about the health of the body and the tissue. And you find apically of all root canals. You notice if you do CBCT, you always see a little bit darker areas. You could call those a bone edema. You could call them osteolytic processes. That's what you see on a CBCT. But I would say in at least 80% of all root canal treated teeth above in the bone, you find huge cavitations.
So just to go back to our initial conversation, so with an extraction, a biological dentist, like what I've been doing, and your protocol, you take out the tooth, you use ultrasonic cleaning,
yes,
long time cleaning, and then ozone treatment, and then we put a little bit of good old PRF, right?
Of course.
And of course, now since you've done the supplementation in the 2 to 3 weeks before, we've also seen that the quality of the PRF is a lot better, right?
Yes, of course. And the whole PRF is better because it's totally simple. You're boosting your body. Just imagine your body would be deficient of any mineral or maybe vitamin or maybe building blocks. Just see it as a house. You want to remodel your house. What things you shouldn't miss is new material to build the house and the workers. But basically, all your patients out there, you're catching them in what I call physiological hibernation mode. They all have nutritional deficiencies. They're in stress. Yeah. They didn't.
We're seeing a huge difference. We're also now started using an ERG-YAG laser in combination with the ozone therapy because it also does localized biostimulation. And of course, with the biomodulation as an anti-inflammatory post-surgery, we're also having amazing results. I work with the ATP38 from Biotech. It's an amazing device. So we're finding that now something as simple as an extraction, after all, is not that simple. So this protocol that you've been talking about for such a long time, that will eliminate the risk of a cavitation, correct?
Yes, correct. 100% correct. Agreed. 1,000%. So, it will eliminate not just the cavitation. Something we didn't even touch on is, because we don't see this anymore, but a lot of you guys listening in are seeing dry sockets. If you do this protocol, no dry socket.
I haven't had a dry socket in years, and that's why I think it's so dangerous that an extraction. Insurance companies. We live in Southern Europe. You have a lot of insurance companies that are subsidizing dental treatment, and an extraction is considered a very, very basic treatment. Like a dentist in their first, not even a surgeon, because at the end of the day, it's not that difficult to take out a teeth. But I think that the name is incorrect. And I want to challenge you to think about this a little bit, Dom. It shouldn't be called an extraction. It should be, because the treatment isn't the extraction.
No.
Treatment is having healthy bones 6 months later and not affecting your immune system. What do you think about that?
Yes, 100% agreed. And like you say, slow dentistry, whatever, biological dentistry, it's all about optimizing the health of the patient. It's not just about restoring your bite. You should at least be able to, in my opinion, every doctor out there should be able to treat the whole body to get as healthy as possible by using all these strategies, quantifying. We are specialists in the oral cavity, so we can do surgeries on the trigeminal nerve, which is kind of like brain surgery.
It is like brain surgery, yeah.
But basically, you will probably agree on this. If you show me how to do heart surgery, it's the same thing. It's a technique you want to learn. It's cutting, it's knowing your anatomy, it's knowing stitches. It's all basically the same. But what the doctor really does is helping the patient accelerate and get to the next level of health. And the funny thing is, in dentistry, if you're doing the biological dentistry way, you are the key in between medical, chronic diseases, and
I'm going to tell you something, and overall health. Sorry to finish.
And overall health, exactly.
So, I mean, since I started looking at this, and I've been doing surgery for 22 years. I placed my first implant 20 years ago. I love implant dentistry. And, you know, I want to make sure that people understand. I know you're a big proponent of ceramics. You know, we've been testing these, but it's not exclusive to that. You know, what the biological dentistry philosophy does look like. I mean, you don't, as you said, you used the term fanatics before. It's just looking at the importance of eliminating toxins from the mouth. Now, I have always, because I didn't know how to call it, because I didn't have the software in my brain, the words in my brain, because my training never gave me the right words. But what I was seeing and you know, I have a philosophy called no half smiles, where I treat the whole mouth, much like you know, so it's very important, people watching this, neither Dome or myself will do part. If a person comes in with a lot of problems, you treat everything or nothing. Even if the patient says, well, then I can't afford it, and you refuse treatment to the patient. Yes. Because there's no point in treating half the mouth if you're going to leave the other half for the next year, which a lot of patients do. And this is the foundation of my no half smiles philosophy. It's like, man, you treat everything at one go. So one-time surgery, one-time cleaning of all of the mouth, top and bottom simultaneously. I think you agree with me that that's very important. Now, having said that, the results that you see in people's energy levels, their mood changes. Explain that to me. How do people, after like 6 weeks, after you've removed all of the cavitations, all of the infection from their mouths, all of that chronic inflammation, following your protocol, taking the supplementation, explain to me why they get more energy and why like headaches go away, body aches go away. They feel better. Their mood is better. They feel like they're not depressed anymore. Yeah. I can't understand that. Explain it to me.
Okay, I have to go a little bit deeper into this because you already said it. You're not trained to have this software. Yeah, you have to first know about immunology, toxicology, and basically how does all these things correlate. Let's make it super simple. Your immune system is there to attack invaders by doing basically an inflammation. And it uses the innate immune system, which is basically macrophages. And the cytokines related to this are TNF-alpha, IL-6, interleukin-1 beta, and NF-kappa B. Those are the ones that make your immune system go berserk. So it's pretty clear in research in dentistry that, for example, cysts underneath the root canal, like periapical abscesses, are always raising pro-inflammatory cytokines. It's also pretty clear in research that pro-inflammatory cytokines are totally linked to major depression. Just PubMed these things and depression.
I actually saw, there's an article that came out in January. It came out in The Guardian, where the head of psychiatry of the University of Cambridge, after 20 years of research, found an absolute absolute correlation between chronic inflammation in the body. Now, for a lot of people that forget, the mouth is part of the body. That chronic inflammation in the body, so rheumatoid arthritis, so on and so forth, was a direct correlation to mental illness, depression, anxiety, phobia, stress. So what you're saying is that chronic inflammation in the mouth, due to, even if you've never had dental treatment, a badly impacted wisdom tooth, right? So you've never said that dentists cause this. You're saying that it can happen naturally in your mouth.
Yes.
Right? And that can actually lead to mental illness?
Yes, it can. It's totally simple because the whole system your immune system gets aggressive. These cytokines, pro-inflammatory cytokines, are chronic inflammatory cytokines. This is how your body communicates. And we know that our second brain, I would call it the first brain, is your gut system. Your neurotransmitters, for example, will be built in your gut system. And only what comes into your brain works. And now see, this part, like you said, is a part of your body. And these teeth are little tiny organs, like a liver, like a stomach, like it has a blood supply, a lymph supply, and autonomic nervous system. And those teeth are connected through one of the 12 cranial nerves. It's called the trigeminal nerve. And this trigeminal nerve will transport everything that's in your mouth, even if you haven't had any dental surgery done on it, into your brainstem within 24 hours. Just think about this.
So I'll give you a direct example. About, I think it was January 24th, I'll be publishing a video. I'll share it with you. In January, my daughter's kindergarten teacher, Alison, I can say her name because she allowed me to speak about this case. She comes to me and she says, Dr. Stanley, I think I have a wisdom tooth coming out. Would you mind if I came to your clinic? She's very polite. And I said, yeah, sure. And me thinking it was something easy, I said, go to the clinic. I'll have your wisdom tooth extracted. Of course, we have the vitamin D thing. And Dr. Anapaj from my team, she does, she follows your entire protocol. We become fanatics like you, and we won't operate if the vitamin D levels are low. But so she comes in, and the first thing any client does in our clinic, any patient does, is a CBCT. And when I saw the CBCT, I was like, oh my God. So she had a impacted wisdom tooth that had a cyst the size of a tangerine. I'm not joking. Like completely eaten out half of her mandible, going up the ramus, wrapped around her lower dental nerve. And my first question when I looked at her was, how's your brain? That was my first question. Not, do you have, because she's got no symptoms, she had no toothache. Now, later I found out that she'd been visiting a dentist on the NHS in the UK regularly all her life, but since she had healthy teeth, apparently, the doctor never prescribed even a panoramic x-ray. So they were only just doing the drill, fill, pay the bill dentistry, which I hate. I'm very anti that, because as dentists, we have to have that third dimension, which is at least an x-ray. I'm not even discussing a CBCT. Now, we take the CBCT. So I see it and I ask her, how's your brain? She has this reaction. She goes, like, you're a dentist. Why are you asking me about my brain? And I said, how's your brain? She said, well, 3 weeks ago, I had to fly back to the UK to have an MRI on my brain. Now, she's about 32. She's healthy. She's sweet. I said, why would a 32-year-old girl have a CBCT MRI on her brain? And she said, well, I've been having these debilitating headaches. I can't get out of bed, 3 times a month. I can't. It's affected my life. I'm nervous. I'm depressive. And she's always anxious. And of course, her symptoms, none of her doctors, and she'd been for 6 years trying to figure out what was wrong with her. She'd been to a multitude of doctors. I know you've got more stories than me about this. And this poor human being, nobody ever said, go get a CBCT of your mouth. And I was telling this adventure of this poor girl who for 6 years was trying to find out why she had these pains in her brain. So she'd gone to general doctors, general physicians, she'd had blood tests, everything. Not one of these doctors at the best hospitals in England even remembered to say, go and look in your mouth. And that upsets me. That makes me angry. And that's why your fight is so important, Dom. All right? Now, I'm with you. A lot of people are getting on the bandwagon. I know you're going to be, even Christian reached out the other day. I'm sure that I'll be happy to see that. You have been knocking on the door for a very long time saying, listen to this. I took out this girl's wisdom tooth. The cyst was actually, so it was wrapped around an impacted wisdom tooth. She had no clinical signs in her mouth, no toothache, no tooth pain, no fever, no swelling, no bleeding. So obviously a human being doesn't think it comes from the mouth, but all of the symptoms were in her brain and in her immune system. We did the surgery a week later, ozone therapy, laser, the whole thing. She hasn't had a headache again. Her energy levels have tripled. Her emotions have changed. She's a happy person. She says we saved her life. Now, why don't more people know about this correlation?
This is, like I said at the beginning, you're not trained to see your mouth as part of your whole body. That's what I'm going to say about the trigeminal nerve. So she had a cyst around this, so chronic inflammation in her jawbone, leading to a chronic inflamed brain and activation of the sympathetic nervous system, which brings her into fight and flight, and she cannot regenerate. She cannot detoxify. She's basically chronic sick. So I'm doing this for, like you said, like for 15 years. I'm talking about this for at least 10 years. And now the book is out. And it's really good that we are talking about this in dental community. There was a time, like with every new thing, there is this saying, and like every wisdom has to go through 3 phases, you name it, right? First, it will be attacked, then belittled, and then it's always been there, right?
Yeah,
And
rejection, criticism, and then implementation or something like that. So I want to get back to, I was talking about the Dean of Harvard Dental School, Dr. Bruce Donoff, who's an MD, Max Fack, who, he's the Dean of Harvard Dental School, and he's 70 something. And we were talking about the history of dentistry and the fact that they took dentistry out of mainstream medicine. I think that was one of the biggest catastrophes in human history. Just that simple, it happened in America, that simple decision to say, we want a separate dental college. And what happened was that the evolution of our medical history, dentistry got relegated to a second status, the poorer cousin of medicine. You're not a doctor, you're just a dentist. And what I think actually is happening here, Dom, is that I'm starting to find that through quality dentistry, it's not a big investment. You don't have to place expensive implants. I'm honestly telling patients that can't afford high-level dentistry, if they're going through these symptoms that have toxicity in their mouths and chronic inflammation, put in a denture. We have a 3D printer in my clinic. I will offer them a free denture. Just get the toxic inflammation out of your body. And PRF is cheap. It comes from the patient's own blood. Supplementation, diet is cheap. Of course, I'm not saying setting up a practice is inexpensive, and we'll get to that in a bit. But you can actually really have a dramatic impact in your patients' lives if you slow down, you improve your patient's supplementations, improve the quality of your surgeries, and even just place a denture in your patient's mouth. You can change their brain, their immune system. How do you feel about that?
Yeah, exactly. That's exactly what you should do. But I think the critical part here is that a lot of the guys following don't know all these concepts. They don't know from university that maybe every metal will lead to an inflammation in your body. So it's pretty clear if you just PubMed it, that higher levels of any heavy metal, for example, mercury from amalgam fillings, will raise inflammatory markers in your bloodstream. So that's basic science.
I want to talk about amalgam fillings. So we're European doctors. What's it like because in Portugal, there's no strong legislation. I mean, most doctors don't use amalgam anymore. I haven't touched the stuff since university. I remember fighting against my professors because not so much because it was bad for the body. I thought it was bad for the environment. Now I understand how bad it is for the body. But do you know that in the US, legally, a doctor cannot say that they should have their amalgam fillings removed? So it's crazy. What are the direct implications then of having mercury amalgam fillings in your body for the system? So, first of all, I'm loving this conversation.
Thanks, man.
And I'm trying to be the devil's advocate here as an interviewer, and making sure that people truly understand how they can start on Monday. I mean, as a speaker, I always think it's important to give them practical steps.
Yes.
And, we can go to why it's so ignorant that so many people don't make that correlation. I think, and as you know, as the founder of Slow Dentistry, which is most about disinfection control, but if you think about it, most dentists are always in a rush.
Yes.
And would you say that biological dentistry is something that inherently you have to take your time with your patients?
100%, totally. So the whole clinical setup we have is super slow dentistry, I would say, because I basically only do 1, maximum 2 patients a day. Of course, it's always all in one surgery. That means I'm going to do the whole thing, like removing all the metals, the cavitations, the root canals, the ceramic implants, etc., in one sitting. So I will have enough time and no stress at all. My whole staff is trained to not even use the word stress, because basically it's just your perception of the world. I'm never in a hurry. I'm never stressed. I just be here to help patients get to the next level of health. That's what I'm doing. And I'm doing it by applying high-tech dentistry, functional medicine, biohacking, all things health optimization.
So we've started already about a year ago implementing the same protocol. For 20 years, we've been practicing slow dentistry. So I see very few patients a day. And I, like you as well, do the whole mouth in one go. And a lot of dentists don't understand. They're like, but hang on. What if the patient doesn't want to treat all the mouth in one go? How do you deal with that?
First of all, I'm seeing myself as a problem solver. So I'm coming with a solution, and the solution is always I make the treatment plan, and the treatment plan is get the patient as healthy as possible. So I treat everybody exactly the same as I would treat myself personally, or my wife, or my mom, or my dad, and we'll always implement this strategy. And if you not agree with this treatment plan, there's certainly another dentist who will help you, but it's not going to be me, because I want to have results. Yeah. So this is a challenge for you as a patient and for me as itself. So to take responsibility. How in the world is a patient able to decide which treatment is good for him? It's not possible, right?
The only reason why they would not want to do it, in my experience, is because there's two. One, well, actually there's three. They don't have the time. Because a lot of patients think that more locations in the mouth means more chair time. So I've discovered that if you explain to them that it's the actual setting up of the operatory, it's the getting everything ready, like the preparation of the cooking, making a meal for 6 people or 16 people is pretty much the same thing. Yes. It's because you have to go to the supermarket, you have to prepare it's pretty much the same thing. So I use that analogy, and I find that it helps them a lot more.
Yes.
The second one is it's the cost, and that's the hardest one.
Yes.
And then, because we all have costs to run our practice, and I would say that that's the biggest challenge for biological dentistry. Unfortunately, you run a practice, I run a practice. High-level dentistry is very expensive. And moreover, if you're seeing fewer patients a day with extra measures of safety and all of this, it does become quite expensive. And I think that that's one of the biggest challenges we face.
Yes, but the question is more like, can you put a price tag on health and optimal health? I think you can't. And it's just a matter of priorities. So if the priority in your body is reaching optimal health, then the question is more like, how much does it cost you to leave toxic stuff in your skin?
How could I not do it? I mean, again, right. we go back to that story of Alison, who spent 6 years flying back to doctors and hospitals and the time and medication. So I am with you on that fight. Now, I want to bring back the conversation. I have some questions here for you. You are a clinical director, as I am. Okay, what changes are you doing in your clinic or need to implement to tackle a post-COVID dental scenario? What are you going to change? What are you going to adapt?
You mean after COVID is over?
Yeah.
Basically, I don't actually have to adapt too many extra things because I already have the highest standard of hygiene anyways already implemented. So we had 2 years ago, we had the whole clinic from I don't know the word in English, from a hygiene point of view, we had to have it certified by the government. It's kind of like the certification for dentistry in Germany changed about 3 years ago, and we have to have the same exact measurements as a clinic setting. So it's a lot of work. It took us 6 months to get that certified, but we made that with the grade A. So that's all covered already. We don't do a lot of patients, so we don't have that problem. So emergency is already running. The only thing we have to do right now in Germany is like super emergency mode. That means no dental cleanings is allowed and no fillings, nothing,
And moreover, because you have the IQ Air aspirator, you've already got the air filtration system. So for people that don't know,
what we use is our water, the drinking and the spitting water, we will always in the morning ozonate the water, which is cleaning everything perfectly. You can drink it, you can spit it, you can rinse it. I have another ozone machine if you like, because I'm doing a lot of crazy things with ozone you can do as a naturopathic doctor. and we can really do just ozonate our water. And this is the best disinfection you could ever find for your whole microbiome before and during COVID-19. After, it will boost your immune system, and it's a penny costing.
So you just put your ozone machine in the water.
No, it's a different machine. I have another machine, which is an ozone generator, which does it from medical oxygen. And I can actually tell the machine how many gamma, they call it gamma in ozone, how much gamma we will use, microns we will use.
Make a little video of that and put it on your Instagram, man, so we can all...
Ozonate the water?
Yeah, man. Show us how to do that. Put it on your YouTube channel. I think that would help a lot of people, man. Why not?
Yeah, I had it in the story once, but I can do that, yes.
Yeah. So I want, much like you, I'm, as you know, I published an article. I was on the front page of the International Dental Tribune about slow dentistry. And I'm just basically saying that clinics that were doing volume dentistry, they're going to have a really tough time. Those are the guys panicking now. Us at White Clinic as well, we're not panicking because we saw, a reduced amount of patients. Our safety measures were insane. We have all of the safety protocols. So I've been trying to tell my staff to relax, because there's not that much investment that has to be made. Now, I think that that's something that the public also has to understand, that dentists need to work in a slow, stress-free environment if they want quality. And I don't think that message is understood by the public. So I think that inherently a biological dentist is a slow dentist, is somebody that really takes their time. Talk to me about your IV drips.
Yeah, for what we do a lot of IV drips, basically as infectious precaution or prophylaxis before. So we have, of course, we will always do IV antibiotics because we're required to do antibiotics when we do surgery. We don't never give oral antibiotics because of obvious microbiome problems in your gut. So we will do an intravenous single shot before surgery, but we will do a lot of nutritional IVs, starting with high doses of vitamin C, which is a common consensus nowadays with COVID-19 anyways. So Dr. Chang from Shanghai, who probably helped the most COVID-19 patients, I think above 400, he gave them a lot of vitamin C, and in between 5 to 20 grams of vitamin C. That's what we anyways do as prophylaxis of infection, or what we say?
Yes, as a prophylaxis of infection. So as protective measures. And we're mixing magnesium and vitamin B12 and even some procaine in that as well.
Yes, the standard IVF design is exactly this. Plus, you would also use sodium bicarbonate to make your pH go lower, which also helps with the viruses and boosts your immune system. That's what it's all about. So and also vitamin C for collagen synthesis.
So we've been doing that as well as a pre-treatment to our surgical patients. So while I'm operating, they have the IV drip going. And honestly, man, the results are amazing. I think that if you really want, it's not so, a lot of surgeons are trained to focus on the surgery. I had a great professor back in the day, and I was training my brain to not release adrenaline. Like a lot of dentists, when they finish the implant or they finish the extraction, they go, whew. And I was like, I trained myself to only exhale after the last suture. The very last one, because it's the last 3 sutures that are really the most difficult. So if you're doing a big mouth case, so I train myself to only relax after I've done my last suture. But now I'm training myself to only relax now for years now, after 7 days. So if there's no dehiscency, no inflammation, and a great post-operative, that's when I relax. And I think, much like an OBGYN that's taking care of a pregnant lady, his relationship with that mother lasts 9 months, and he can only relax when the baby is born. So I think as a biological dentist, you can only relax when your patient's symptoms change. How do you feel about that?
Yeah, I'm always relaxed, man.
I love it.
I trained my brain to never have stress at all. So I'm totally switched off the fight and flight response. That's has to do with the setting, no time pressure. Actually, what I'm doing is my passion. So I'm loving everything I do. So it's basically not work. And I'm very good with my breathing patterns. And it's all kind of like an artwork. When we do just the basic surgery stuff, it's an art. And I use all the strategies in terms of healing the body, recovery, biohacking, health optimization, in order to help your inner body, because surgery in these studies is pretty clear. The surgical part is not the most important part. Of course, we do that as minimal invasive as possible, doing as least trauma as possible. But before and after surgery, what the lifestyle of the patient looks like, if the body is able to heal and regenerate, this is where the goal is. And of course, you as a doctor has to be confident, because your patients maybe are coming with a little bit of fear. So basically, I never be stressed. I never stress my staff. I'm just chilling and relaxing and helping the patients and having time for this. So no time pressure is a big thing here.
You have a sentence that you use, which is rest and digest.
This is the parasympathetic nervous system. So basically what we want to do with all those things we do, we remove the trash, we help your body get out of chronic sympathetic mode, which is fight and flight. And we want to bring the patient into rest and digest, which is the parasympathetic nervous system, the vagal nerve, which innervates the whole gut organs, the whole detoxification, regeneration, the whole excretion. Everything happens through the night, and only if the parasympathetic is active. There are patients, because of the problems on the trigeminal nerve, due to mechanical procedures in your mouth, that are not seeing the light. They are always in fight and flight and chronic stress because of an overactivation of this autonomic nervous system. And we can take them out of this. And also you as a doctor, a lot of time with the adrenaline and the rush and the cortisol and the high achievement and everything, you're always in stress and firing your cortisol and your adrenaline all day long. You just have to balance yin and yang. And this is very, very important, because otherwise you won't heal.
How frustrated?
It's blocked when you're in sympathetic nervous system.
How frustrated do you get? Because I know you're a good guy. You're a genuinely good human being, and I know you care. And you wrote a book about it, and you dedicate all of your energy to this. It's not marketing. I know that, because I have a filter in my brain that I know when things are bullshit and when things are not bullshit. And because I do have a deep understanding of surgery and dentistry, it was easier for your programming to take over my brain. And since I was the clinical director of White Clinic, I could implement those changes with zero resistance. And I'm 100% private practitioner. It was easier for me to do it. And to such an extent, just so people, I actually had cavitations removed from my mouth. And I know Dr. Luis Besser operated me. We did the whole process. And, my energy levels changed, man. I mean, like, seriously. And I'm talking by my own personal experience. I had some wisdom teeth extracted when I was in university, and I know they didn't do a good job, because it was just extraction and suture. I had wound agency, and I had to take antibiotics. So I remembered in my brain that I had to clean that up. And honestly, it did change. It did change. So how frustrated do you feel that this isn't more mainstream?
No, I don't get frustrated at all. It's just like, I think I give my best to make it more mainstream. It takes years and years and years. So let's say about 5 years ago, when I gave a lot of speeches on general dental congresses. So I gave seminars for interested open mind dentists, which was always fun because they are interested in this. But at the end of these 2 days, I would give, like, say, a 30-minute lecture in front of 150 general implantologists. And this would always end in an emotional discussion, attacking me personally and having problems. So I decided back then I skip this, because this is not worth my time, and it's their problems. It's not my problem. I don't know what it's just like, it's the Matrix, I'm Neo. I took the blue pill. They didn't. So they are the guardians in this case. They just don't understand. So I decided to not do this anymore. When the book came out, I didn't think about this. The book is written for the layman, but also most dentists are laymen in the term of these whole body concept things. So everybody could read it. And I'm in a little town here in Tubingen, in Germany. So it's about 80,000 people. And everybody knows me anyways. All dentists know Dr. Nischwitz from the outskirts. He's the crazy witch doctor, Like, our dental colleagues, they are not open-minded always. And I love all you guys, dentists out there. And
a lot of jealousy, man. A lot of jealousy.
Yeah, and you cannot imagine the biggest shitstorm ever, like 2 months, daily letters in the newspaper, this Dr. Nischwitz guy, and this, and this, this. And then this again really sucked. But on the other side, I just thought, I didn't even respond to this because basically it's their problem. Like you said, it's mostly jealousy, and maybe they don't even know. And what you said, if you don't know me personally, and you just see me on video and maybe what I'm talking about, of course you could see this as marketing and this guy's only doing money with this. I don't. I do this because of passion. I want to help people. And actually, if you're a little smart like you are, you will see initially that you will have a better practice, a better office. The patients love you. You don't have dental patients like, oh, I have to see the dentist. I hate you, dentist. It's pain. They all wait for the appointments. They love it because they're seeing health. And teeth come only second. Of course, I will do the perfect aesthetics, but they will come. Oh, I'm not depressed anymore. My shoulder joint is gone. Or like you told about Alison, she can think clear again. The brain fog is gone. She can sleep again, whatever. This is the fulfilling part besides
100%.
the part of surgery.
You know, I was in the last year, I mean, you know, I've been doing for 22 years now, and, you know, my body of work is well known, but you know, I built a practice of doing amazing implant cases, beautiful aesthetics, digital dentistry, where, you know, I'm the vice president of the Digital Dentistry Society. I talk a lot about this, and I've had a lot of fun with the new technologies and stuff. And it's impossible to be a dentist in the modern world without these technologies, you know, without them. But very few things have brought me such personal fulfillment as introducing biological dentistry into my practice. And it wasn't expensive. It wasn't. I had kickback from some people in my own team, I can tell you that. And it does take extra time to explain to your patients.
Yes.
Especially because they don't know. And but since I practice slow dentistry, that time is factored into my business model anyway. Do you understand?
Yes.
And this truly, truly changed my life. The gratitude I'm getting from my patients. You see the level of trust going, because you're not offering just. I mean, I'm when you make a beautiful smile, it's amazing. You get emotional. It's incredible. Or when somebody can chew an apple again, it's amazing. But when you change their energy levels, their thought process, their overall health, it's an incredible thing. And I want to thank you for putting that on my radar, for sitting down next to me in Cannes with that energy of yours, and just being so laser focused, my friend. You have a lot of I mean, my wife is super critical. She's a big fan. I think Eleni Shura, her friend from Russia as well, he's fanatics, you know, in the whole model world. You know, they follow a lot of gurus, and you've definitely won the hearts and minds of a lot of people, not just dentists, with your consistency, you know, very consistent. So I really want you to keep it up. I want to thank you, and you can always count on me. And I just want to ask one last parting question. What steps, or what are the compulsory steps, should a dentist look for when he or she wants to improve their own immune system? And moreover, what's the first steps they should take to become a biological dentist in their day-to-day?
Yeah. So the easiest thing would be, for the first health, just really read the book. It's all in your mouth. It's kind of like combined, and look the YouTube channel. There's a lot of information, but basically start by taking responsibility, change your lifestyle, because 9 out of 10 chronic diseases, and this is our epidemic, are lifestyle based. So the things we said is, go to one of the last 3 Instagram posts was boost your immune system. There's everything as a summary. The critical things in diet, it's the red chart, the green chart, like avoid all these processed foods, go with vitamin D3, a little bit of supplementation, work on your mind hygiene and sleep and all these fundamentals. But if you want to really implement this strategy as a dentist in your clinic, this always has to start with yourself, and you have to do this consequent. You just want to shift your focus from basic repairing and the high-tech skills, and additionally bring in the whole body health concept and learn all these things. So we have a full curriculum in place. You will find tons of information. I'm giving all my information for free. Just go on our website Maybe you have some show notes. I will send you all the links if you need for the Zoom. And you can have all the articles and the book, and you will find, and I'm also the president of the ISMI. So normally we would have our meeting in May, but everything is canceled down and for lockdown mode. So I don't know when the next convention.
You are going to be at a biohacking conference in September.
Yes. 100%. The biohacking that's what's next thing I wanted to talk about is go to the Health Optimization Summit. It's the European equivalent to the Upgrade Labs. It's where all the great minds in health optimization, biohacking will speak. I'm also going to be a speaker there and will show all the other guys the health starts in your mouth concept, so that we finally don't always talk from here down, but also start implementing this. And there you will learn everything. So because basically what you need to do, and I have a nice health matrix for this, we need the lifestyle, which is nutrition. We will quantify by doing lab works here, functional medicine, so that we really know what we have to do. Then we supplement. Then we, of course, in the dental office, we have to remove the source. We have to remove what's already there inside.
All of it, not just part of it.
Yes, 100% consequent. Start with yourself. And then, of course, you go back to nature. You ground yourself. You go anti-inflammatory. You deal with EMFs. And you do all the other things, biohacking, which you could actually implement straight away. So you could follow.
Explain people what EMFs are.
EMFs are electromagnetic fields. Like on your phone, you would see 3G or 4G. I hope they didn't roll out 5G in Portugal just yet, but they did.
I'm very scared about that stuff.
Yeah, everybody's scared about 5G. And it will just add more frequencies. And what it actually does, your body has an electric component. We call it the electric body. You know from university that the cell has a voltage, minus 30 to minus 60 millivolts. And we know that calcium ions, which are positively charged, are outside mineral, and inside we have magnesium, like negatively. What happens if you go and have your Wi-Fi on and your 3G and you're on an airplane? These electromagnetic waves will open voltage-depending calcium channels and open the cell for calcium will flood into, and will change the inside voltage, which of course renders enzymatic processes, but also just leads up to production of superoxides and peroxynitrites, basically oxidative stress, which you have to deal with and make you it goes against longevity. It's a lot of huge stress. And if you want to know a little bit more, this book, EMF, from my friend Joe Mercola, is a good one. And also the last post in my Instagram are about EMFs. It's really, really critical and important that at least, this is a takeaway message for you guys, have your iPhone or whatever phone you use in airplane mode as much as possible. No need to load up more electromagnetic fields on your body, and switch off your Wi-Fi at least at night. I don't even have Wi-Fi at home. I have everything in landline, Ethernet. My whole clinic is EMF-free certified. My juicery store is EMF-free certified. I'm doing this for 10 years and it was woo-woo, but ever since last year, EMFs, and you can read this here, the whole research, EMFs are carcinogenic. It's the same as cigarette smoke. And it's the same marketing still, like the doctors did with cigarettes. So they say EMFs are the cigarettes of the 21st century, because still we're working with doubt, and nobody, actually you probably didn't even hear about it because it's so convenient. And it is convenient, of course. You can go and hook up to the internet everywhere. 10 years ago, they just started with Wi-Fi, and it's kind of like a huge experiment they're doing on the general population, and without even knowing what will happen. But now the science is there, so just be a little bit careful. I'm not the guy who's saying go and hide everywhere. I'm more of the fan of like, okay, use these techniques and tricks and biohacks to make your unnatural environment natural again. So if you're in an office all day long, then at least shield yourself. For example, I have everything on cord. I don't use Bluetooth. So I even have a mouse, which is on cord. I don't use Bluetooth. I do everything that's possible. My clinic actually doesn't need Wi-Fi. Why should it need Wi-Fi? All my patients go into airplane mode when they enter the clinic, because it's another stressor. And what we want is the least stress possible, the better your immune system. Extremely important in COVID-19 times. So
that is an amazing final message, man. And it's an overwhelming amount of information, and it's almost like you need a parallel life, to to understand all of this, but I'm going to tell you something from experience. It's 100% true. It's 100% real. I believe in it. I'm practicing it. We've been doing it. We've seen the change in our business. We've seen it growing. We've seen this. This is not a trend. It's just medicine. It's just, I think that we were not trained as dentists to understand the power of dentistry. We were not taught to make the connection. And I want to thank you for making the connection. I want to thank you for finding time in your busy schedule to talk to me. This video will be made available on miguelstanley.com and on your website, which is?
You can find it, of course, on YouTube, which is just Dr. Dominik Nischwitz, and Dr. Dom1, DRDOM1 on Instagram. We will put it out on all the socials.
All right, my friend. Listen, I want to talk to you again. And hopefully once this madness is over, we can do some more things together and perhaps even create a specific seminar to change dentists, to help them change as well and do greater good. All right.
We should 100% this, because now I can tell you, ever since 2019, finally my work takes off. So the 10 years before, like mostly the guys I trained were old dudes that they have seen that just dentistry is not enough. But since last year, all my friends, the cool kids, I call them, they are finally coming. You're a cool kid too. I'm a cool kid. I want to become a professional skater. And if we make this happen, we are going to be changing health. And I think the 20s are going to be the health decade. And dentists are the connection between chronic disease and high-level achievement and the regular medicine. And because we're looking for optimal health and not for absence of disease, and we can actually start in your mouth and see it straight away by just looking there, and then implementing all the other things which we have to train. And the cool kids are coming, so we can change something big time.
Thank you, thank you, thank you. Dankeschön, meine Freund. Stay safe. Take care of your family. I'll see you soon, man.
Thanks, legend.
Boom.
Cheers.
Bye-bye.